We asked and you answered. How much have you paid for a COVID-19 test and where did you go to get it? The answers are all over the map and often depend on whether you have insurance. KXAN Investigator Erin Cargile looked into why and, more importantly, where to get a test for free.
Good evening. Dozens of viewers responded, even co-workers at KXAN. We found charges ranging from $0 up to $6,000. That's even with insurance. We got the most complaints about the drive-through clinic here in East Austin, which admitted today there were billing errors made by a lab they promise will not happen again. COVID-19 testing is no longer limited. There are lots of options across Central Texas where you don't even have to get out of your car. But not all drive-through clinics are created equal.
People who are going in for COVID testing are not supposed to have to pay.
But dozens of viewers tell KXAN they did pay, anywhere from $100 to $250. One guy said he paid an urgent care clinic $168, even with insurance. The founder and CEO of ClearHealthCosts.com says it makes no sense because the major insurance companies are supposed to be covering it.
Well, hospitals, labs, clinics, and doctors can charge whatever they want to charge in healthcare. They always have done that. But in our crazy system, the actual payment is governed by the insurance system.
If you're uninsured, some drive-through clinics are charging a flat fee for a COVID-19 swab test. Austin Emergency Center says their test is high quality and more accurate than some. The cost recently jumped from $199 to $249. AEC says it was due to the rising cost of supplies. The facility, with 4 Austin locations, is a freestanding ER and says every patient who pulls up gets an assessment and physical evaluation, just like they would inside. Therefore, AEC bills a patient's insurance for 2 fees, one for the evaluation, plus a facility fee that covers basics like water and electricity to keep the doors open 24/7. It's something patients tell KXAN they were never told. Pender says there are vital questions you should be asking up front to avoid surprises.
How much is this going to cost me on my insurance? What's the cash price? Can I have that in writing?
And if they won't give it to you in writing, she says take notes, take names and numbers so you can relay that info back to someone if you get a high bill in the mail. 3 viewers who reached out to us say they came here and their insurance was billed for blood work they never had done. AEC told me today that was a mistake made by the lab. It's being corrected and those patients will not have to pay a dime. I've also reached out to that lab and I'll let you know what they say. Back to you.
And if you're looking for a free test, here's what you need to know. Every single person with or without insurance who went to a community care clinic, CVS pharmacy, or an Austin public health testing site told us they didn't have to pay a dime. Testing was free at these locations because the programs are all government funded.